Hello, everyone. Welcome to the Narcissismdecoder podcast, a podcast that takes a comprehensive look at the various facets of narcissism from different psychoanalytic perspectives. I'm your host, Dr. Anthony Mazzella, and as always, I'm joined by my co-host, Christina. Hi, Christina.
Hi, Dr. Mazzella.
Hi. So in today's episode, we will explore the punitive superego, a topic that is an extension of our last episode on the relationship between narcissism and perfectionism. The punitive superego is very common among individuals with perfectionistic and narcissistic tendencies.
The title of this episode is Addressing the Mental Health Struggles of Healthcare Professionals, Breaking the Cycle of Punitive Superegos. Dr. Mazzella, do you want to tell us how did you get from perfectionism to a punitive superego?
Sure. In part one of this topic, I discussed turning to the literature, and in one particular study that I mentioned, it was noted that amongst medical professionals, there exists a fear of punitive consequences. I wanted to look into this, and I was paying close attention, and what I realized was the fear was predominantly rooted in apprehensions rather than concrete realities. While there were instances where some validity could be attributed to these concerns, these fears, I approached this fear mainly from a psychoanalytic standpoint.
Can you break down for listeners what you mean when you say psychoanalytic standpoint?
Oh, that just means in this context, at least, understanding a fear of punitive consequences involves exploring the underlying dynamics that contribute to this fear. For instance, one thing I began to consider when thinking about this fear was projection. Psychoanalysis suggests that individuals often project inner thoughts, feelings, and conflicts onto external situations. In the case of fear of punitive consequences, it may mean attributing inner feelings of guilt or shame or unworthiness onto external authorities, that's the projection, and then imagining that they will be punished.
Yes, this projection idea is very common in the work of clinicians. We learn about it, we think about it, but as is the idea of the punishing superego. But many listeners may not know how this particular state of mind in adulthood results from the early stages of development. I don't think we got to that in episode 1. So can you make those links for listeners?
So the main takeaway for today's discussion is that, this is from part 1, a quick review, is that our self-representations, how we think and feel about ourselves, are deeply influenced by our experiences with the significant people in our lives, how they think and feel about us. So in other words, how we see ourselves is often a reflection of how we believe, how we imagine others see and respond to us. That's what I was just getting at with the fear of consequences, that they imagine that people will behave towards them in a punitive way.
What other theories or thinkers do you like to draw upon in your practice to make sense of how we internalize or take in the way others see us? Are there other theories?
This is one theory. According to Bion was a psychoanalyst. He thought his theory was infants are born with the ability to experience raw sensory and emotional data, but they depend on a caregiver to help them process and make sense of these experiences. So let me just give an example. These are the raw emotional responses to stimuli. It could be a sudden fear, like a surge of fear. It could be joy. It could be anger. It could be some internal discomfort, hunger, gastric distress, But the point is that there are things that go on inside the developing infant child that they don't know how to make sense out of. And it's the caregiver's role. That's the role of the caregiver, to gradually help the child, the infant child, how to think. And back to the word symbolize from our last episode, to symbolize their inner world. Bion believed, and there's substantial research in the field of child development, like for instance, Bowlby, that much of the early communication between the infant and the caregiver occurs on a nonverbal level through emotional attunement, bodily sensations, sensory experiences. The way the caregiver holds the baby, for instance, is very important. Touch. So all of these things, these are nonverbal forms of nonverbal communication, and they're crucial in shaping the infant's and then child's emotional development and a capacity to think. So I'm emphasizing that because when we get back to the patient and the topic of the punitive superego, we have to think about the capacity to think. And one way, Bion theorized, one way the caregiver helps the developing infant move from these raw sensory data experiences, what he called beta elements, for those of you who are familiar with Bion, he said is through the alpha function. The alpha function refers to the mental capacity to transform these sensory and emotional experiences into meaningful thoughts and symbols. And again, symbols is verbal language, something you and I had a nice discussion about at the end of our last podcast. So the mother's ability to contain the infant's emotional distress and help them process it is essential for healthy emotional development. Mm-hmm. So if we can, we gave a little example in the first episode. Let's take it from a slightly different perspective. It was that example of a child who comes home crying because they scraped their knee, and then there's a caregiver that initially had the ability to contain the child's emotional distress, comfort the child, not just clean the wound, but provide soothing words to help the child begin to process the pain, the fear, what is an overwhelming situation. And we said if the caregiver shows empathy and comfort and provides practical care, this will help the child process both physical and emotional aspects of the situation. So that's the raw sensory data, right? That's the beta elements that I mentioned earlier. And they start getting put into words, that he's hurt, that he's in discomfort, but that he's going to be taken care of. And in this scenario, the child may feel a range of emotions that they don't know how to process initially. It's not just physical pain. They could be upset. They could feel vulnerable. They could be scared. And again, these are all the beta elements, what Bion calls beta elements. Things that are not necessarily conscious, but they go on in a very, very intense way inside of us. And when the caregiver provides the comfort and care, that's the alpha function according to Bion, the child may start to feel reassured, loved, and supported. And the soothing words and actions of the caregiver can help the child feel more secure and less distressed. So that was all a little bit of review, but let's picture a very different response from the caregiver because we want to build into the punitive superego. So this would be the beginning of the development of a punitive superego. If the response, if you can imagine again the scenario, the kid comes in crying and screaming, and the caregiver yells at the child, "What did you do? What's the matter with you? You're driving me crazy," and interprets the child as clumsy, but the caregiver then experiences the child's behavior as an attack on the caregiver, on him or her, right? And they have to defend themselves now. So what do? They push it back onto the child. What's the matter with you, right? In other words, there's nothing wrong with me. In no way was I, there wasn't an oversight. I'm not a neglectful parent. I don't know, whatever might go through a parent's mind. The main goal is to attack the child, and the child may end up feeling unworthy of love and as if they shouldn't exist. They're just a burden. The child is just a burden now to the caregiver. And if you remember, self-representations are formed based on how we feel others are perceiving us. We just mentioned that a moment ago. And this is what we internalize. So you could picture in this scenario with this young child is beginning to internalize a sense of what? That they are bad, right? So the message conveyed to the child is, it is you, like it's your fault. And I hate you for doing this to me. You want to drive me crazy. Something is wrong with you. And this type of relationship, if you just one more moment to the listeners, I just want to make the link now directly to the punitive superego and the perfectionistic self. So this type of early relationship, as you can imagine, is highly ambivalent. And the developing child is unable to resolve and integrate now what they have, back to the word integrate. They can't integrate these contradictory feelings because they're so intense. And the struggles which were originally between the child and the ambivalently loved caregiver slowly over time come to exist inside the child. That's the internalization. So it's like an introject comes into the child and into the child's superego. So the representations, since they are highly ambivalent and conflictual, there's no integration, they get distorted and they get exaggerated, right? Because if there wasn't such intense ambivalence, love would sort of modify the anger. And conversely, it would work the other way around. But there's not this integration. And what happens at that moment is the world becomes populated, that's their inner world, with contradictory part objects. Part objects means that the caregiver becomes either all good, or people in one's life become all good, or I feel all good or all bad.
Interesting.
So I bring it back just to this type of internalization often stems from a lack of resolution and integration of these contradictory feelings that are experienced. And an example like I just gave with that type of caregiver.
I'm just curious, do you think that this Bionian theory has any connection to Freud's primary and secondary process? It makes me think of that. Primary process, lack of thinking capacity, more emotional. Secondary process, symbolization.
Mm-hmm. Yeah, absolutely. So if you take it one step further, what were you thinking? Like, what's the overlap between Bion and primary and secondary?
I'm just wondering if there was any, it just sounds like you can map it right on. Mm-hmm. What is Bion adding to Freud by beta and alpha function that you couldn't say with primary and secondary process? Do you think there's any?
I think he's adding something. I'd have to go back and brush up on Freud. But what I think he would add is much more significance than Freud. Freud paid close attention, right? Starting with his structural theory that the external environment did become important to him. But I think Bion puts far more emphasis on that interpersonal relationship and how significant it is, right? For the development of, symbolization, the capacity to think, the capacity to talk, to use language in a way that's meant to communicate feelings. So I would say the biggest difference is Freud was maybe paying more attention internally, where Bion would be paying a little bit more attention to the external environment. And in this case, this example, the failure, the alpha function of the external environment.
It's as though he's taking that earlier theory by Freud and making it apply to the relationship, seeing it map on relationally.
Yes, absolutely. So let me pause another. Is anything else that you were thinking, Christina? Or?
No, I just thought that would be interesting to mention here.
Yeah, it's a nice distinction you made. So let's give another example just to sort of drive it home with a perfectionistic patient. So in this example, the perfectionistic patient comes in and talks about how she was raised in a very loving and supportive family. So it seems like the first example we gave from last week, like if this woman were to fall down and scrape her knee, she has this kind of parenting. She grew up, everything was good in her life. She was, her words, she was very attractive, outgoing, played sports, she had musical talent. But recently she came to me because remember I mentioned in episode 1 that some of these caregivers sought my help because they were having problems. One thing that I noticed that sort of cut through many of these individuals that I was seeing in my practice was the inability to write their notes. So she was having a hard time writing her notes, her patient notes, and she came in one session and she told me that unexplained, she had a migraine over the weekend, right?
Mm-hmm.
There was no reason for this. She just had this really intense migraine headache. Now, in terms of applying the theory, if we want to go back, when I hear this kind of stuff, already I'm thinking, if we're just thinking of this particular theory, that something very intense was going on inside of this woman that was not articulated. There's not a capacity for symbolization. In other words, if we use Bion's language, there was something with beta elements that did not have the alpha function. And if you subscribe to this theory, if this theory makes sense, then our job with a love, and by the way, I'm trying to be mindful of our listeners that we're not just talking to practitioners. So I always try to tell the listeners to imagine that this could be a loved one, a family member, a friend of yours, but that this is somebody who you want to try to be helpful to them. And to be helpful, it's really important to figure out what is the best way to talk to this kind of person. Because this patient, for example, admittedly said, I'm hypersensitive. Like I'm really sensitive. In other words, it's hard to be told anything. So the initial intervention with this kind of friend or family member or patient would be something like this. Hold on. Let's slow down for a moment if we can. Let's go back. When did that migraine headache start? Do you remember exactly when it started? And then she begins to talk about the pressure she was experiencing at work. That, of course, like a perfectionistic, not uncommon trait, a narcissistic patient, they do everything at work. Nobody does anything. Everything falls on her. Nobody recognizes all the work that she does. And if this woman was behind on her notes and her supervisor spoke to her. But sometimes with these patients, they're so sensitive that even just talking to them about something, as many of you know who are listening, it's already enough to sort of ruffle their feathers. So she was very upset. And she went on, her words, not mine, to talk about how she's a perfectionist. And we started to look at her perfectionist, the need to write the perfect note. So when her supervisor spoke to her, she said, my mind freezes and I can't think. And I can't formulate a way to assert myself. And of course, the supervisor is like being mean to her from her experience, from her perspective. And she wants to create a boundary and speak up. But she gets increasingly frustrated and mad at him. And in the session, she gets angry, but she's angry with him. She's like boiling. She's mounting. She's full of anger and she begins to cry. So again, just according to the theory, Bion would say what? There's something beta elements inside of her, and she doesn't have this capacity to get it out. And her mind freezes. She said, I can't think. That's the whole point of the theory, is that these patients don't have a capacity to think. And when I say think, I mean in a productive way to put in, to soothe their own anxiety. That's different than being obsessive, something we need to think about more. So under the weight of this mounting anxiety, because she doesn't have the alpha function, She told me that she confided in her mother. And in response, her mother urged her to focus on the positive and stop questioning. The mother questioned, why are you always so negative? In other words, you just need to be positive. And then the mother, she told me, was very reassuring, that she said, everything is going to be fine. So I began to explore this. Again, this is the intervention, is we slow everything down.
Just remind me and the listeners, she had a similar upbringing, you said, as the original example with the child who scraped his knee?
The original example, yes, but what was the original example? Remember, that's what the comforting mother.
Yeah. Was she a comforting mother or a not so comforting mother?
Well, that's the tricky question. That's the $1 million question that you're raising, Christina, because oftentimes people feel like they had a very wonderful, comforting, childhood experience, and they can't make sense out of why they're experiencing, like in this example, these somatic symptoms, or why they have other problems in relationships, or why they can't seem to get their work life together.
Mm-hmm. So she remembers having a comforting mother. That's what she presented in the treatment.
Exactly. Yes. Yes. But then when you start to pull away at it just a little bit, so for instance, in this case, I'm exploring these feelings about what was it like for you when your mother said, just focus on the positive, don't focus on the negative. And what she began to describe, and using her word, not mine, is that she felt invalidated. So as we started to talk about this feeling of being invalidated, what emerged spontaneously, and that's when this stuff is quite genuine. Whenever you use an intervention on somebody, or you talk to somebody in a certain way, the most important thing is not whether or not they agree or disagree with you. It's where do they go next? What do they do with this information? Because I'll tell you, I listen to many podcasts, and it's common where a podcaster will have a guest on and they'll do therapy, like a consultation for 45 minutes in a podcast. And yeah, we should take one of these, Christina, at some point, like we did in our last episode. We can open it up in an interesting way, because oftentimes the patient in the podcast will say, thank you so much. This is so helpful. I never thought about it this way. As the therapist gives like these brilliant insights into what the problem is. And then a couple minutes later, they'll say something like, yeah, but do you really think it's that? And they'll go on to undo everything that was just told to them because they don't really understand.
Well, it's also what you said
told.
earlier about the child who scraped his knee, that this negative, internalizing this negative emotion, that's the way the child connected with his caregiver. There was a lot of, contrary to the woman who you just discussed, in the initial example, the connection was primarily formed from the negative emotion, because maybe that's what predominated in the relationship. Maybe this parent was not very emotional except when there was a negative situation. And that's when the child felt noticed.
Yes. Yeah. And then I think this is what you're getting at. So that's what then becomes internalized and goes into the superego, right? Is this negative connection with the caregiver.
So it's not like it's a conscious selection. I'm choosing the negative over the positive. It's just that the negatives are more pronounced and the child maybe feels more seen than in other situations.
That's right. And just to digress just for one moment, a patient, as we was, again, pulling this apart, not this one, but one said to me something like, negative attention is better than no attention at all.
Exactly. Right? That sums it up. That's what I wanted to say.
And that's why it's important for them to always, well, that's a whole nother step. We won't go into that. But what I was going to say, we'll push this to a later podcast because this is much later down the line. But a patient like this may be more inclined to look for negative situations because that's what's validating to them in this, this internalized way. But okay, so back to this case. So as I was exploring this feeling of being invalidated, what began to emerge spontaneously was when she was much younger, whenever she achieved something significant her mother would proudly recount to her own circle of friends, attributing the accomplishment to her own advice, guidance, or mentorship. It became clear that her mother habitually claimed credit for the patient's successes, leaving her with a lingering sense of unacknowledged achievement. So there's the achievement. That's the perfectionist. Remember, we spoke about how there's a high level of achievement and they can never reach that. Remember, that was going way back to episode 1 at the very beginning.
Well, it seems like whenever this patient reaches something, the mother tries to take credit for it. So she maybe has to keep going. It's never enough.
She has to keep going. That's right. Right, because the mother's response not only suggests a lack of empathic understanding, but also sent an implicit message that we don't talk about. We don't talk about negative emotions, right? Like, in other words, stay positive. Don't talk about things that are negative. It implies that something is wrong with negative emotions. Now, again, back to the theory. Because if you use the theory, you just keep it sort of tucked in the back of your mind. This makes complete sense in terms of what's happening with this patient. Is Bion would say, we don't process negative emotions. So growing up, she learned. Well, she never learned. She never developed the capacity. There was never alpha function there. There was no conversion, right, of undigested, uncomfortable, raw sensory experiences, internal experiences getting translated into verbal thought, symbolic thinking. She got the message. It was just the opposite. Leave beta elements alone. Just think positive. In other words, don't work through them. Just think the opposite and you'll be okay. So what we see is in moments of vulnerability and distress, she turns to the mother, like the kid with the scraped knee, right? In a moment of vulnerability and distress, she's overwhelmed about what happened at work, beta elements. She doesn't know how to make sense of this. She turns to the mother, and the mother responds with a dismissive and invalidating remark, more beta elements. So now the poor woman is flooded with these sensory experiences that she does not know how to digest. She doesn't have the language. She's not helped with the language. So what does she need to do? When the patient achieves something of significance, we said this already, I'm just reviewing, and you said it, Christina, the mother's habit of taking credit for it, right? And diminishing her accomplishments. So the patient doesn't know what to do with this. She doesn't have the language except to do what? Overachieve, like you said a moment ago. And that's the way this thing manifests. She has to write the perfect note, but there is no such thing as a perfect note, as we all know. So you can't actually write the perfect note. So then you end up falling behind and you get yourself in trouble with your supervisor in this example.
Mm-hmm.
But the competitiveness of the mother could also contribute to this patient's sense of needing to constantly prove herself. And that is then the link right there between that. This is the way it manifests in this relentless pursuit of perfection, constantly needing to prove herself.
Right. And this kind of case can be in the clinic misleading when patients describe, well, it couldn't have been my father because he always told his friends or told our family how high achieving I was. But the part that goes missing, I think, is that part that you pointed out, that the parent is taking credit for it, the way they're announcing it. And that I think that can easily be missed, right?
Mm-hmm. Right. And it is missed because you picked up on this earlier on when you were trying to clarify, wait a second, does she come from a supportive family or not? This is getting confusing because it is missed, because this patient in particular, not all patients present this way, but she needed to hold the image in mind of the perfect childhood, right? The perfect family. And that's sort of, I think, what holds her together, right? Because if you can hold that image in mind, then you don't need to get into all this other stuff, which are really painful feelings of all the things we're mentioning, the competitiveness, being dismissed, unempathic responses, not feeling like you exist. Everything is taken over by your parent. That stuff is not pleasant to get into. It's much easier to write a perfect note, right?
Right. Yeah. Yeah, exactly.
I was just thinking if there's anything more that I can say about this. And then I was going to ask you if there was anything more that I missed or anything else I can clarify.
I mean, the only thing that's blaring here is that since we are talking about narcissism, is the example is of a narcissistic parent, the one who usurps the credit, who wants to be the one in power. Any of your accomplishments are because of me. This is classic narcissism, right?
Yes. Yeah. Yeah, and I didn't want to label, I was hesitating to label the mother, but you're picking up on it only because she's not on my couch, so I don't really know what's going on. Oh, actually, maybe that's just one other thing I could digress into quickly, which is, again, according to psychoanalytic theory, one of the definitions that I mentioned earlier in terms of like the way we feel about ourselves, is based on how others see us, right, and respond to us. And then we gave that example with the scratching the knee, right, falling down and scratching his knee. But one other thing that our sense of self is also based on is how we perceive others are responding to us. So in other words, in part, there's some reality to this, of course. And when you hear enough of these stories, you can hear that there's a reality. But you have to keep in mind, if you're subscribing to the psychoanalytic theory, that we also treat some of this material as fantasy. Because when this stuff gets carried over to work, and there's this incredible fear that everybody at work is going to punish you. Remember, I said I treated it psychoanalytically. I treated it like a fantasy rather than a reality, because this is the way the patient would perceive these people in the environment to be behaving, even though they may not really behave that way.
That's a really important point. The filter, the fantasy, the projection.
Yes, that's the projection. That's right.
Well, thank you so much for joining us today. We've covered a lot of ground on perfectionism, Bion's alpha function, the paranoid projection from the caregiver into the child, and then how you worked with a perfectionistic patient to modify her punitive superego. That was quite a bit.
Yes. And it's just like last time. I feel like we've covered quite a bit of ground, Christina. This is always fun to be doing this with you. But as always, I feel like there's so much more to say regarding the perfectionistic personality and the punitive superego. We just scratched the surface today, but we should leave it there for now. I just want to remind the listeners, if you have any questions or want to dive deeper into any of the topics you heard today, feel free to reach out on any of our social media channels. We would be delighted to hear from you. So until next time, bye, Christina.
Bye. Until
and
next time.
To the listeners, engage your mind. We'll see you soon. Bye. Disclaimer alert. The Narcissism Decoder podcast is provided for general information purposes only. The content presented in this podcast is not intended to diagnose, treat, or cure any psychological condition related to narcissism. The content on this podcast should not be considered a substitute for professional medical advice, diagnosis, or treatment. For specific advice pertaining to narcissism or any other psychological condition, you can reach out to us. Christina and I are both experienced mental health practitioners who are always taking on new patients. If you would just like a consultation, we could do that too.